Welcome to the Dentalflix Uncut podcast. I am here with an incredible guest and a woman who has just such a powerful story, who has brought me to tears multiple times in our interactions. And I'm so excited to share this story with you today on Dentalflix Uncut. Dr. Parul Dua Makkar, welcome to Dentalflix Uncut.
Oh, thank you so much for having me. Good to see you.
Great to see you. It is our absolute pleasure to have you on this podcast. And let's just kick off by sharing with our amazing audience who you are and the impact that you're making in the industry today.
Sure. So, like most listeners, I'm a general dentist. I'm in private practice in New York, and I was happy in my little bubble doing my little dentistry in my little place. But my life took a different turn when I lost my younger and only sibling, who was also a dentist, to oral cancer, of all things. And it was during the time of COVID, which was very difficult. And since his death, I've just been raising awareness to oral cancer and that, what it is, it impacts everybody. And my brother was diagnosed at 32 and passed away at 34. So gives you the impact of this horrible disease.
And how are you? Well, this, one of the things that I'm just so like inspired by you is like you've taken something that was so hard and so tragic, and you've really taken that and built a momentum to help so many people in the industry. And you've just been rocket shipping in our world in dentistry and speaking on stages and writing books and hosting your own symposium to bring more awareness. So, share a little bit more about that work that you're doing.
Sure. So I really felt alone in my journey while battling cancer. And, cancer doesn't affect just the person who has it. It affects the whole family. And I'm sure many listeners who've had themselves or watched a loved one will attest to that. And so I was very alone. And even with the grieving process, because it was a man who died in 21, I had to say goodbye to him on a video call. So the grieving process was alone. And I've traveled so many places. I didn't have my circle of friends that I grew up with, or even my family. My parents live in Canada and I in New York. So I had to find my own self of support system and to heal. And that connected me to a lot of people. And I found it therapeutic, as well as I didn't want his death to be another statistic, another death because of cancer. I wanted this to be a change and a movement in having dentists be more vigilant, doing more comprehensive exams, vocalizing it, talking to their patients, and normalizing um, oral care and how it's a gateway to overall. And we're not just looking at a one tooth and get those veneers and cosmetic. That's all great, but realize there's a person behind that tooth. And we, as dentists, um, and if we want to be in the same regard as our doctors, we want to get that message across that we're looking at you comprehensively. We're doing, ortho because we want to expand your airway. We're not just teeth doctors, we're overall comprehensive care doctors, and cancer plays a huge role in that. And so I created this Do a Good Job Symposium. Dua is my maiden name and my Manu's last name. And the symposium is a comprehensive view on oral cancer beyond just diagnosing and screening, but knowing what to do afterwards. How do you take care of a patient who has oral cancer when they're coming in? Do they need fluoride trays that then doctors don't realize? And I think I'm talking about physicians, there is a disconnect that they need to go see their dentist before they start radiation chemo, because we know the risks of dry mouth or osteoradionecrosis later on if they need dental work after treatment. So getting them before, and this is why this course is comprehensive and targeted to all healthcare professionals, that we need to be giving home care instructions, what products are good to use or not. I have a cancer survivor who talks about nutrition, what you should and should not eat. You should not have a high sugar diet, and what things are easier because your taste alters, your swallowing ability alters if you have head and neck radiation. You have skin issues with third-degree burns from radiation. So there's so much more than just saying like, oh, that lesion looks suspicious. Do you know when to biopsy, what to biopsy? There's more to this than just sending it off to the oral surgeon and washing your hands off of it. Um, And then what do you do after? What if your practice, you're a dentist and you have cancer, which many of our colleagues have had, or your partner does, and how do you support that? What things you need to navigate through, taking care of decisions for your practice, your life. So, and thriving afterwards, that let it not define you, let it make you stronger and better.
So this is called Dentalflix Uncut. And what's really important to us with this podcast is that the listeners, they take action, right? We wouldn't have had you here on the podcast. We wouldn't have you in Dentalflix unless we, or because, the reason why you're there is because we realize that like you're an impact maker and you're making change, right? And so I really would love to maybe hear a story of somebody that came into learning about what you're teaching, working with you, and really a transformation that happened as a result of them being serious about learning and knowledge and growing.
Yep. I've had a couple of dentists who have reached out to me that, hey, I never really paid attention to it. And there's a story, I'm not going to take the name of the doctor, but she came to me and said, hey, because of your brother, because of your story, I had this lesion, and it turned out that this patient ended up having stage 4 cancer, and he was a father of 4. And because she heard me speak and paid attention to it, she was a little bit more diligent about it and followed up. And this patient is still alive today. And with head and neck cancers, early diagnosis is really the key. And had she not, maybe he would have not been in this world. And there are many stories of that have reached out to me, whether it is patient care. There was actually a physician who heard me speak, and she brought her husband, who is stage 4 cancer and is on clinical trial drugs. He has stroke, he has history of other cardiac issues, and he can't have a lot of treatment. And she just brings him to me every 3 months because she's like, I can't find anybody else who will take the time to educate or to clean his teeth, because he can't brush, he can't open his mouth, and it's a mess in there from all the treatment. And she realizes the importance, and she's like, I don't find that empathetic treatment. People just brush it off or don't want to deal with it. So I've heard it from both patient aspect as well as the dentist. And then I've also had an impact from people who have traveled my path and have found themselves alone. They're like, we just didn't know anybody to talk to. And you get me. And I just want to talk to you. So, and it's not only been within the United States, it's been globally. I've had people reach out to me from different parts of the world because they've heard the story and wanted to either reach out clinically or non-clinically.
This is why I like get full body goosebumps and like teary eyes every single time I talk to you, every single time you're on a podcast with me. I just really want to honor the work that you're doing, because for you to go through something so traumatic and difficult and then just take that and do something with it is not easy. And it takes a lot of courage and vulnerability. And I just love to see the impact that you're making in our industry.
Thank
And
you.
so if you have like a call to action, if that makes sense, like people that know you and listen to you and get to meet you, what is the one thing that you want them to really start doing or thinking about differently?
One of the things is, and I think I mentioned this before, is like, treat your patient as a patient, not as a number you have to fill, that you have to meet the certain quota, you have to make X amount of money in a day. It'll come as long as you do the right thing, and patients realize that you are taking care of them and that you care about them, not making, I think dentists have this bad notoriety, like, oh, they're just trying to make money off of me. It's about educating your patients why you need to do this, and talk to them and educate yourself and the patient at the same time. Let them be in the part of the decision-making process.
So first of all, we're really excited that you have a course in Dentalflix. Uh, but I would love for you to share, people are listening. They're still listening right now in this podcast, and they might be asking, like, how do you help? How can you help me? What do you do? Like, how can I work with you? Right? Because we're here as connectors, right? As Dentalflix to connect doctors and team members to people that can help them, right? That's what we're here for. So, how do you help doctors or team members specifically? And I'd love for you to, be able to share that.
I think one of the ways is to join my symposium, which is going to be a webinar. And it's going to be, Allison, you've helped me out, so thank you for that. But it's a symposium that will air on June 27th, which would have been my late brother's 37th birthday, and it will be available on Kajabi for 6 months after, so you don't have to, if you can't take time off work. I wanted it to be available for people at any time. And so the way I've linked it is, we have a range of speakers, and my whole idea is that when you join the symposium, you get the access to all these people of different specialties, from oral systemic health to hygienists for screening, with patients who've traveled this path, with people who have stopped practicing dentistry and are doing something different with their degree, but not clinical. And so that there's so many options. There's lawyers in there and physical therapy on how to do movement. So there's so much wealth of information, and I think it create a different network, like, of resources available. So one of the things is join it in, and it will give you what I have been searching for the entire time, and that's where this whole idea came for. And so yeah, do a good job, do it.
Something I'm noticing in dentistry right now, like, is people that are willing to pull in all the pieces together to make things make more sense. Like, for example, not knowing potentially what your role is specifically as a dentist, or not knowing, like, how do you help even more. And I think anybody that's in dentistry is impact driven in some way or another. Like, they want to make an impact in their patients' lives. They want to help and serve. And Anissa always says, like, as dentists, you're healers. And I couldn't agree more with that. And I think something that's just really important to note, like, even if you're not a dentist, if you're a dental hygienist, if you're a dental assistant, if you're a dental office manager, pulling all the pieces together of what is the treatment plan, what is the prevention plan, what is the post-care plan for a practice, is something we all need to know. And you've done such a good job finding the people and putting them in the spot so that we can come to this symposium and have it all make sense for us. So I just really encourage everyone needs to come to this symposium.
Yes. Thank you. Yeah. Because it's just not, sometimes they're shy away from talking to the dentist. They'll talk to the girl in the front, right? They have a more relationship sometimes with than the dentist they'll see for a few minutes. Or the hygienist that they'll open up to. So yeah, everybody in the team can join in.
Oh, so how do they join in?
Well, you go to DUA, goodjob.com. And then there's links. And we actually have an early bird right now for the end of this month. It's a leap year. So make the leap to do a good job. All puns, leap and do a. So there is a early bird special right now for the end of this month.
I love it. I love it. And we definitely want to share that with all of our network as well. So anything that we can do to help you, ultimately, we're all healers, and we're all here to help each other grow. And that's really the mission of Dentalflix and Dentalflix Uncut, right? And so
Yeah.
what we can do to help support you, sending it out to our email list, whatever we can do to help support, because people really do need to, they need to get involved with this. I know early on as a young clinician, I'll tell a story. My my ex-husband, one of his best friends, and he's an oral surgeon, but one of his best friends was a general surgeon, and they did med school together back at UAB. And and his good friend's wife was a patient of mine,
Mm.
and young couple, and I found a lesion, and she's not with us today. And you take, a doctor, a young doctor who's got, got a family,
Yeah.
and it's not easy. And I will tell you, in dental school, there's definitely not enough information about what to do when you have a lesion other than send to the oral surgeon, which is what I did. But we do that because we don't know what to do.
Yeah.
Right. And so having a way to be able to get knowledge, we talk about being healers and saving people's lives. Like, this is something that, as you said before, if we could detect things earlier, then we can save lives. And so I appreciate and honor, as Allison said, the work that you're doing, and taking a little time out of your day to learn. It's absolutely worth it to be able to save a life and be able to have your team participate as well. Can you remind me again of the symposium? Is it a couple of hours? Is it a couple days? How is it? Yeah.
It's a full day. I'll be there live, but you don't have to be there if, work and other obligations, but it's on Eastern time because I'm in New York. So it starts from 8 a.m., goes all the way through. It'll be divided into 6 sections, because we're talking about the treatment, prevailing, understanding what cancer is, and as far as decisions we have to make. So it's going to be set up in 6 different segments. And CEs are being provided for dentists as well as for hygienists or dental assistants. So even you're learning and you're going to be getting CEs. And then you could go back and rewatch it. So it will be available once you purchase. And people who do purchase before the 27th will get a signed copy of the book, and there'll be some swag with the Do a Good Job.
And can you remind me of the price of the summit?
Sure, it's $249 for dentists as well as for dental hygienists, which with CEs. And there's an option, it's a little bit lower for if you are a physician, and for dentists, dental students and residents. So even if you're in residency, I know you don't need the CEs, but if you want to learn something, come on aboard. And it's really important for young people to be aware of that because, Manu was their peer. He was in his 30s and he had just started a practice and, paid off student loans, and he was on a high in life and never thought he would have cancer. I still remember him showing me the tongue lesion in June of 2019. And he sent me a WhatsApp picture. He's like, "What do you think this is?" And I'm like, "Dude, it doesn't look good. Can you go get this biopsy?" He's like, "Nah, I got my oral surgeon friend looking at it. I've got other dentists." He's my kid brother. He's 8 years younger than me. And I went to see him in July, which I do. I travel every year. And I looked at his tongue and it's brown, leathery. He couldn't have sushi. He's like, the wasabi hurts, my ear hurts. I can't sleep, my jaw pain, all signs of, really aggressive cancer. And I'm like, "Show me your tongue." And I looked at him and I'm like, "Are you blank kidding me right now?" And he's like, "No, no, no, I'm getting the biopsy. I'm getting the biopsy." And the whole time he was in denial that I cannot have cancer. He was a rugby player. He played badminton, golfed, kayaked. I mean, he was as healthy as you get. And he never thought that this would be it. So, yeah. So important.
So important. Ugh, my heart goes out for you. And I think this is just like, we have to learn. That's it. Like, we have to learn and we have to take this information and we have to think, like, how can I, do something with this knowledge? Because you're sharing this with us for a reason and you're sharing this with the industry for a reason. And, when I was a dental assistant, I think I was 22 in practice, and we had a patient come in completely bombed mouth. And I was confused because I didn't know what was going on. I was really excited to ask my doctor, like, what happened? And it was a patient that had gone through chemo, and afterwards, like we had, restored her teeth and, she was in kind of the healing phase. I remember her and I just sitting knee to knee and like, Allison, no one told me how to take care of my teeth while I was going through this. Like when I was going through all of this treatment, I didn't have any information and I wish I did because I could have probably not had my like the decay and everything that happens afterwards so aggressive. And, just thinking of all of the things that you're bringing towards the industry, like as a dental assistant, that could have helped me even write a protocol for the Cancer Society in that country or just help in some way. And so I think like really listening to this podcast, I want to challenge everyone that's listening to this, like what or how can you take this information, take this story, and just like Parul says, like don't let the death of her brother be a statistic. Don't let the death of anybody with oral cancer be a statistic and actually like take this knowledge and understanding and apply it to your life and your position and your role because we all can.
Yeah, we can save a life. Had he been diagnosed earlier, he'd be sharing the story. And he did. He shared it on Dental Town. He was on the cover and he talked about his own cancer in the journal. And he in fact wrote an article that came out just as he was dying, which is in the book. Like literally he died and the article got printed the next day. So but yeah, and he wrote knowing that he was going to die. He knew tomorrow wasn't promised to him. And I think tomorrow's not promised to any of us. But he knew he battled it 3 times. And you will see people who've had cancer treatments and how they are disfigured and what psychological impacts. And I do have a psychologist speaking on that as well, about how you think your life's going to turn out and what actually happens, and it may not align. And you don't go into depression, but you work through those challenges.
Mm-hmm.
Yeah. So, and that's what his book was so interesting, is because he writes battling the very thing he was meant to diagnose and knowing that tomorrow is not coming. But he always felt that the human mind, body, and spirit have a remarkable capacity to heal. So for your listeners, like, we are stronger than we can imagine.
Wow. Thank you so much for sharing and being here. If you can, again, share how everyone can go ahead right now, turn off the podcast and go register. They get registered to attend this incredible symposium.
Thank you. Yeah, you can go to DUA Good Job, GOODJOB.com. Yeah.
Thank you so much,
so
Parul.
much. No, thank you for having me and being so generous with your time and energy and all the love.
We are here to support you and thank you for bringing this mission to dentistry. And I can't even imagine in years to come how many people's lives you're going to impact with the work that you're doing. So thank you so much for being on Dentalflix Uncut. Please go and register for her conference right now.
Yes. And you'll get the copy of the book and some little swag, and I'll be in Calgary soon. So hopefully I'll get to maybe run into you in there.
Absolutely. I would love that.
Amazing. Thank you so much, guys, for listening to another episode of Dentalflix Uncut. And we'll see you next time. You just unlocked valuable insights with Dentalflix Uncut. But there's more. Dentalflix is not just a podcast. It's a thriving community, a hub of knowledge, and the #1 online streaming CE platform in dentistry. With just a few clicks, you can start exploring a wealth of resources, including in-depth training on leadership, case acceptance, scheduling, hiring, weekly marketing calls, insightful gap assessments, and scorecards, all designed to help you master what you discovered today and propel you further on your path to dental excellence. Head to dentalflix.com to get started for free and embark on your journey towards mastery. Thanks for tuning in to Dentalflix Uncut. See you next time.